1410th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. Veena C. from Hyderabad. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic students, doctors, and homeopathic lovers. We started this session at the time of pandemic, and we have 3 sessions in a row, and we have participants from 65 countries presented various papers on this forum. And just we completed our Hindi session, and from 8 to 9, the international session in English, and 9 to 10, we have a local language session in Malayalam. This is what happens with the homeopathy at Ifph. And we have today our guest is Dr. Veena C. from Hyderabad. She has presented various papers in this forum. Almost all the papers are really excellent. She always go into the depth of the subject and will come out successfully with some of her cases also. And today, as you know, she is working at Hyderabad, and she is having clinic there in Hyderabad. Even though she belongs to Kerala, she settled down at Hyderabad now, and she has more than 10 years of experience. That is something great as far as her activities are concerned. She is a person who is working hard to bring homeopathy to the topmost level, and such young generation doctors are the need of the hour, and we need to continue our system. We need to bring our system to the top. So we proudly welcome Dr. Veena to the session today. Dr. Veena will be presenting follow retrospective analysis. This is a topic which she will be talking. And anyway, we proudly welcome you to the session.
Namaste. Namaste to all the doctors, and warm welcome to all of you to this forum. So today I don't have a presentation to present with. I want to share my experience. So before starting going to the cases, I would just like to have a few words.
Please adjust your camera a little more. We can see only half part of you. Yes, and that's good.
Okay. So, I submit my pranams to all my gurus at this opportunity, and I also thank IFPH for giving me this opportunity to present my experiences in this forum. So I congratulate also IFPH for continuously taking this webinar since 3.5 years, and it is going successfully, throwing a lot of experience and insights about homeopathy to all budding homeopaths by sharing great experiences from all the legends of homeopathy who is practicing now. Thank you so much. So we will go to the today's topic, follow-up. So how a follow-up gives insight about whether the case is proceeding towards success or a suppression or a better prognosis or a bad prognosis. All these things are getting assessed by doing a very good follow-up of our cases. So generally we give a prescription, and the patient says he is okay. Then if we leave out without understanding what has happened or without analyzing, then we will end up in more failures later if we don't assess the case. So when they say I am all right, or when they don't turn up, if we think the prognosis is good and a prescription is correct, we will be ending up in failures later. So it's better to always analyze the case and understand how the prognosis is going, whether it is for the betterment of the patient or not, whether the remedy given is the correct remedy or only a partial simillimum or totally an unwanted prescription which has gone into suppression. So for this, we just need to understand how the what is Herring's law of cure. We have been discussing about Herring's law of cure, I think, from our first year of BHMS. But why Herring's law of cure? How scientifically is this Herring's law of cure giving insight about the prognosis of the patient? These things are more relevant, but we tend to not understand during our BHMS years. So we just say we have to see whether the symptoms are proceeding from above downwards, from interior to exterior, from most important organ to less important organs, and is in the reverse order of appearance of the symptoms. This is what we learn about Herring's law of cure. Why Herring's law of cure? That we tend to not analyze or understand during our early practice or early learning about homeopathy. But logically speaking, if we tend to understand about this Herring's law of cure, why Herring's law of cure is saying above downwards, why it is saying from interior to exterior, why it is so. So I think Dr. Vijayakar sir has given a detailed description about all these things in his book Theory of Suppression. But this is more relevant, then we will never tend to miss the case. We will never tend to understand whether we are proceeding toward correct prognosis or not. So for which we just need to understand the embryology of human anatomy. So how the embryo forms and how is it formed with all organs, and how is it born in this world as a human being. So we say that every cell in a human body has got the 46 chromosomes. So that is how it becomes a human being. That is the Homo sapiens. So the cell, the zygote formation is the first stage. From there on, the cell divides and it goes to form the blastomere, and from there the three layers, ectoderm, endoderm, mesoderm, all these things are formed. So when so the cell, once it divides and it becomes to some extent, then it has the symmetry, like right and left side of the body, there is a symmetry formation. So the cell has the DNA. That is the first process of formation. So the cell getting affected or genetically mutated will be the last stage of the disease. So that should be the last stage of the disease. So when we get, the embryo develops like this. So there is a symmetrical formation. There are three layers formed in the embryo. That is the ectoderm, endoderm, and mesoderm. Then from the ectoderm, there is a curve forming into the neural plate that is called the neuroectoderm, from where the CNS develops. So you have the cell and symmetry with the DNA, which is the main thing, which forms the Homo sapiens to get born in this world with all the organs formed. So the next stage is the formation of three germinal layers, and we have the ectoderm, endoderm, mesoderm, and the neuroectoderm. So the neuroectoderm develops into the CNS and the PNS. So that is the neurological development of the baby in the first stage. So when we have the neurological development, then the body needs to grow and it needs to form all of the organs. So the next thing what needs to be produced is the growth hormones and all other hormones, which is going to set the growth or development of the body of the fetus. So then comes all the hormones, and the hypothalamus and pituitary and all the endocrine glands, all these things are formed in the next stage. Then comes once the growth hormone is formed, then we have all the structures getting developed in the body. So we have the lung, hearts, the brain is the first one. Then we have the heart, lungs, then all other respective organs like kidney till skin. Then we need nutrition to all these organs. So the nutrition is through the blood vessels and the lymph. So we have the all organs, then the blood vessels and the lymph. Then once these organs are formed, they need to be protected by the skeleton and the muscles. So then comes the connective tissue and the bone, skeletal system and the muscles and also the skin, that is the dermis. So this is the next layer. Then comes all the tracts like respiratory tract, GU tract, GI tract, all these tracts which is connecting the internal body to the exterior. Then comes your nail and appendages, cornea, conjunctiva, all these things. So that is the ectoderm. So we can understand that there is a neural formation, then the hormones, then the organs, then the connective tissue, then the tracts which is connecting to the exterior. Then we have the nail and appendages, which are the lesser important organs. So how is it formed? So now we get to know the body forms from the neural plate, that is the brain. So we have the CNS and PNS, that is the most important. Then we get the lungs and the hormones, then the lungs and heart. Then we have the other organs, and that is how the mesoderm, then endoderm, then ectoderm organs are formed. So this is the way it is formed. So now we can relate this to the Herring's law of cure. So he says above downwards. So there is in 2 to 3 weeks of embryo formation, there is a end defined, like which will become the head and tail and which will become the posterior and the ventral organs. So that is called the cephalocaudal axis and the dorsoventral axis. So this is how the body designed, like where is the head and where is the tail. So above downwards. Then we have the posterior to anterior, from interior to exterior. Then we have most important organs to the lesser important organs. Then we have reverse order of cure. So to understand what is the reverse order of cure, generally we go only by the symptoms, but we need to relate this to the miasm also. As per Dr. Vijayakar sir, he says that we have to relate to the reverse order of the miasms. So what is SORA? It is just simple inflammation. What is psychosis? It is hyper or hyposecretion or any deformities or external growths or internal growths. So any accumulation, any disfigurement or any hypo or hyper is coming under psychosis. Then we have the syphilis, that is the core restrictions. So when we say, when the patient is presenting with just soric symptoms, he will be in the layer of SORA. But if he has gone to sorosyphilitic, then from syphilitic to SORA it should reverse. If it goes to SORA, psychosis, then it should reverse to psychosis to SORA. If it goes to psychosis to syphilis, then syphilis, psychosis, then SORA. So we can relate according to the presentation of the patient and assess the prognosis. So this is how we relate the Herring's law of cure to the embryology formation. This is well explained by German New Medicine also. So from this, we can understand how the layers are getting suppressed by during treatment or without treatment. So, so this is how we have to assess the prognosis of our patient in each and every case, be it acute, subacute cases, chronic cases, one-sided diseases, any disease we take, we have to assess the patient with these things through either by the symptomatology of the patient or the biochemical analysis, the blood reports or any other reports, whatever we take in the patient, or seeing the disease, like from which layer does it get to the next layer, or it is staying in the same layer in different direction. All these things needs to be assessed carefully in order to understand the prognosis. So now I would like to jump into some of my cases upon which I applied, and I get to know how this theory or the system itself, homeopathy itself, how great or how it is working and how I'm failing in each case and what needs to be done next. So every follow-up is important. Not every case opens up in 1 or 2 prescriptions. It takes a lot of time to understand some of the cases. It takes very little time in some of the cases. So it never, a patient or a case, never, you cannot judge just by seeing the patient or by judging the diagnosis to tell that our case is successful or this is easy or where it lies. and all those things. These are some of my experiences. Now I will just try to throw some insights on this. I had a 7-year-old boy who presented with fever. So his CRP levels was almost 10. So he had fever on and off initially. Then they were giving some Bell, Naxomica and all that. The child was not well, but after a week or like 4 to 6 days, the patient has presented with a CRP level of 10 to me. So the fever is much, his activity is dull, and he has got hyperpyrexia now. So they wanted to admit the patient. Before admitting, they just consulted me for what to do next. So he presented with some symptoms. I repertorized the case. I gave some remedy, but it didn't work. The fever remained same. Again, they were rushing to the hospital. On the way, I got a symptom like the patient was sweating a lot, but the temperature was not reducing, and it was hyperpyrexia. So I just referred boric materia medica and I gave pyrogen 1 dose. So as soon as I gave pyrogen, the fever reduced a bit. The child was okay, but the activity is still less. But the fever is persisting, but it is has come down from hyperpyrexia to lesser level. He is not throwing any other symptoms, but this much difference I could make. So I just wanted to give one more dose of water, 1 teaspoon, and just wait for some more time and analyze what is happening. So now, after 6 hours, now the patient has no temperature. No temperature. And the patient is okay. He has become active. He started asking questions as usual, like any other child. Then he had good appetite. So he asked for something. So until this 1 week, his appetite was not good. So he ended up eating something, and he never throwed up, or he never had any symptoms of rhinitis or cough or anything. So now the fever has subsided and the patient's general vitality has improved from the sick state to normal state. So he has come back to the normal state. Our prescription is correct. What to do next? Next is wait and watch. Now after 4 days, the fever subsided, but still they had a doubt whether the CRP level has gone down or not. They went and checked the blood. Since the patient's vitality was good and he did not come up with any more new symptoms which is pertaining to any other system, then I thought the prescription is good, and it was good to go for a CRP check, and it came to normal. This is the acute case. So I had one more case where the lady presented with fever, and she had some throat pain, rhinitis, and some hoarseness of voice. This is a stage he has come to me. So it may be like 4 to 5 hours of fever. She has ended up meeting me. So when I asked her, she said there is incontinence of urine while sneezing or coughing. This is the symptom she presented, and I repertorized the case. For that time being, whatever symptoms I got, and the remedy indicated was phosphorus. So I have given the phosphorus. After that, the fever subsided immediately. She is active, but I just wanted to understand whether she is okay with this prescription or should I go for the next prescription, because she had both sneezing and coughing complaints also. So and she had this hoarseness of voice also. So the fever was due to acute infection, and it is not simple rhinitis, or it may be pharyngitis or laryngitis. So still more down, and it should not end up in bronchitis, which is exterior to interior. So I just wanted to ask for the symptoms. So the patient, I asked what happened to the incontinence. So the moment fever stopped, she had no incontinence of urine, but still she had sneezing and coughing. So sneezing and a bit of occasional coughs were there, but her incontinence has stopped. So the nervous system which was involved during the phase of fever is no more a presenting complaint now, meaning the most important symptom or most important organ involved in this particular acute case is eradicated. So now she is throwing up with sneezing and coughing. Should I go for a better prescription or repeat the dose, or should I wait? Now, since the fever subsided after 6 hours, Then I just waited. And if at all, if the fever or sneezing is persistent, I wanted to go to the higher potencies. Then since I have already given phosphorus, I just waited. Then later on, slowly the cough reduced. Then later, the sneezing also reduced. So it is in the most important to lesser important organ. So the cough reduced, incontinence reduced, cough reduced, only sneezing remained, that also reduced. Hoarseness is better. She is all right in a day or two. So this prescription is correct. But not every case is going to be this successful, especially even if it is an LRTI or URTI or any fever or any other acute infections or any other chronic diseases for that matter. So when we say the acute or self-limiting diseases or the viral diseases, why do they say self-limiting? This is a question which was there always. But when I saw the literature, I found that in viral diseases, it starts with fever. For example, if you take measles, chickenpox, all these things, so it starts with fever. Then you have either Koplik spots or any mucous membrane involvement. Then we have the rashes outside the body. So this is a self-limiting disease because if it gets worsened, it will go and affect the brain. You may get encephalitis. So why? Because the ectoderm is connected to the neuroectoderm. So what happens if it gets suppressed? It goes to the neuroectoderm, affecting the brain immediately instead of most other organs. So that is a presentation. Why is it so? Because these two are closely related. Ectoderm, then we have the neuroectoderm. So it is directly going, and if you give a remedy and it goes to the brain, that means we have suppressed the disease. So whenever in polio or any other disease, chickenpox or any viral encephalitis, if we get to know the case, we will understand that they have suppressed the fever or the rashes through any medicine. So if the body's immunity is good, it will not get suppressed till the higher level to the neuroectoderm. It will get suppressed with some psychotic symptoms, and they may be presenting with not well since chickenpox or that viral fever, and they will have some joint pains or some other problems which is limiting to the other organs if the patient is in psychotic phase. If it is he is in syphilitic phase, the patient may go to the encephalitis, and it may go to a fatal multi-organ failure also. So in viral disease, when we say self-limiting, most of the cases when the immunity of the patient is good or when the patient is still in SORA, they present the symptoms, they throw the disease from interior to exterior, and they'll be all right. So once that viral multiplication is limiting by the body's immunity, he will be all right even without medicines. So in this kind of prescriptions, we should be very careful not to suppress the disease from the exterior to the interior, to the neuroectoderm. So now I think in amoebic encephalitis, which is getting presented in Kerala nowadays, so we get to know this is how it becomes fatal. They give medicine for the fever or the diarrhea or whatever the case is presented with, and this amoeba enters the brain. There is an encephalitis. So the patient is in sorosyphilitic phase. When the syphilis becomes more, the patient ends up in fatal outcome. So we should be very careful. Then I had a case of next case. I would like to present this because this is a 6-year-old child, very frequent recurrent cough, rhinitis and allergic symptoms. He was keeping on throwing every month or every 2 months. It was not periodic, but it is coming in irregular intervals every now and then. It's like every time the patient comes, I take the case, I'll repertorize the case, or I'll refer the materia medica. I'll be giving some medicines, one medicine. Then he will come up with more symptoms. Then it may go to the second medicine. Then it will get subsided and he will be all right. So the main peculiar symptom in this patient was whenever he has cough, he had leg pains. This was presented every time. I referred the case. Initially, I gave arnica. It didn't work. Then I thought leg pains, maybe Rostox may be helpful. Whenever I repertorize the case, I am ending up with one or the other remedy. I am trying each remedy every time, but I am not successful because we are getting the recurrence irregularly, but in intervals. This is what's happening. So I wanted to assess this case. So I sent the patient for CRP test and other tests. And we got to find that the patient has very severe vitamin D deficiency, and the patient's parents were doctors and they wanted to give D supplements. But I don't want to give D supplements because it is in the deficiency level, it is more interior and it is affecting, and he is getting pains. So when I referred nerve repertory, I got the medicine capsicum, and through IFPH talk, one of the doctor, he also get to say that for vitamin D deficiency, capsicum and silicea were very good remedies. So referring this, I gave a dose of capsicum, and still the patient is under treatment. He has coughs, but not that frequently every month or every month or two. So in this case, what happened is we were just giving symptomatic treatment. The patient was all right. Again, he is coming back with the symptom. He is symptomatically all right. He is coming back with symptoms. But when we get to know the scientificity behind that, he had severe vitamin D deficiency. Once that gets corrected, then slowly he is getting recovered from the on and off recurrency of the problem. Because I have tried tuberculinum, I have tried all the medicine. In each go, I take the case, repatriate, reformatory medica, give a medicine, but he is coming back. And once I gave capsicum, that is the indicated remedy, and he is all right. So now these are the acute cases. Then now I would present one or two chronic cases also to understand from which layer to which layer it transferred and how I ended up in giving some medicine. Again, a patient of 30-year-old, this lady who is unmarried, she came to me with recurrent cough and continuous cough. This cough, when it will stop and how long it will prolong, she is unable to say. And what is the triggering factor? She is unable to say. Then I kept on asking questions whether it is related to monsoons or whether any allergy to any food or to her cycles or anything. She is unable to say what is the exact problem. How is it getting triggered? No idea. So every time she's coming, we are referring, we are giving the medicines. And later, uh, when I just asked, like any time you got, see, that some of the patients, when they present with acute complaints, they don't disclose about their previous histories. How much ever you probe into the case, sometimes they fail to say because they think that these two are not relevant and they don't come up with the symptoms. So when I ask the patient repeatedly, after say for almost 3 to 4 months later, then she came up and she told, I was admitted, like before coming to you, 1 or 2 months before, I got admitted in the hospital and I had a blood transfusion. Now I asked for the papers, and then she got me the papers. And I saw only the HB level was very less, like 6 or 5, and she had been transfused some blood. So had this been without any pathological condition, the blood transfusion itself could have helped her. There is no platelet difference. There is no other bleeding points. Nothing with the patient. Now, how did she end up with so much of anemia? No clue about that. So I just asked them to repeat the blood test, and I also gave for thyroid test. But in the earlier report, the thyroid tests were normal actually. She has been given only blood transfusion and she has been discharged home. Then later she has developed this cough symptoms, persistent symptoms. Now, in the meantime, I repeated the case with whatever symptoms were relevant at that time, and I got iodine. So since I got iodine, I just gave her one more test along with the blood test for the thyroid profile test. Then now the test came like she has hypothyroidism. So here the peculiarity is she is not gaining weight, but she is in hypothyroidism. She is eating well. She is hot, but she is not throwing any symptoms of hypothyroidism because probably it is in the initial stages, but it is affecting her blood count. The moment I gave iodine, her cough reduced first. And I waited for some more time whether is there any recurrence. Yes, after 1 or 2 months, she again got the recurrence of the same cough with no throat pain and no fever and other symptoms. So again, I repeated iodine. Then now, this time also, I didn't want to go for the test. When I asked for the blood reports, her HB count was 9. Earlier, when she was admitted, it was 5 or 6. I don't exactly remember, but it was very low, and they have transfused blood. So now I waited for 2 more months. She had one recurrence, and I repeated iodine. The next time, if you have any symptoms, you just go for a blood test and come back to the clinic. This is what I told her. So the third time, when she came back, her blood reports were normal. Her HB is normal, but she came back with same occasional cough, recurrent coughs, and that has a prolonged duration. But this time, the duration between 2 episodes were much longer. So I repeated one more dose, and I just waited. After a year or so, when I see the case now, she doesn't have any cough or any other symptoms, and she is all fine. This is a chronic case but presented with acute symptoms. Here also, initially when I was treating the case as an acute disease and I was missing many points and I couldn't hit the case properly. So when I got the history, the moment I got her past history and gave her the blood test, and when I related everything, then everything fall in place and the correct medicine was hit and she is all right. Then if time is there, we'll go for one more case. This is a case of psoriasis. This lady who was a teacher, 62 years old, and she was been presenting with psoriasis since years. She head to foot, she had a very bad psoriasis and she was not very reluctant to come even out of the house. So she came out of the house one day by some reference and came to the clinic presenting with a lot of shedding of the skin with severe psoriasis, full of red in color, which is presented to the clinic. Now I have taken the case, then I have given CaliRs and with repeated prescriptions like monthly once or 2 months once, we repeated the dose and later after 3 months, she was all right, completely cured of psoriasis. This is what was the presentation by the patient. Now I thought the CaliRs, the prescription was apt and she is all right and she has no psoriasis. She never turned up for almost a year. Sir, after that, again she started presenting with psoriasis when she got back to the clinic. So now she has presented with psoriasis. Then I believed that CaliRs is the right prescription and I gave her the CaliRs. But this time when she came, she was very moody. She had she was emotionally disconnected with the family, everything. Something is hinting me that she is not all well like the last time. But she had some emotional disturbances and there is a presentation of depression kind of symptom which is more interior than the psoriasis what she is presenting. But since I was overconfident with the prescription of CaliRs, I wanted to go with CaliRs. I gave CaliRs 1 dose. This time, what happened? In 2 weeks, to my surprise, it got subsided immediately. I thought, okay, it's all cleared and she's all well. Now, what happened? After 4 weeks, she presented with vomiting immediately after eating. So I gave CaliRs 30 potency. So she came with severe vomiting, projectile vomiting immediately after eating or drinking anything. She has lost her appetite completely, very indifferent with the family members, and she is talking many irrelevant things. But still in she was in her mental condition is good, but still she has thrown up all these mental symptoms along with this severe projectile vomiting. Now I was very skeptical about how to go about this. So what is the prescription should I give? And she was presenting like I'm getting wave like some motion in the stomach. Immediately I am throwing up. I am averse to drink water and eat. This is a very highly syphilitic symptom because the patient is unable to eat anything. So eating is the nutrition which gives the body to live or to grow. But this lady is presenting a symptom which is against nature to live. So meaning it's a highly syphilitic symptom and she is not normal. So I asked them to go for a CT abdomen. So they went for the CT abdomen and the diagnosis made was some lipoma inside the abdomen on top of some part of the intestines. This is what they have given the report. Now, my question is, she had psoriasis, which is highly syphilitic. She is shedding all the skin and she had severe itching, burning, red color skin and all that. I gave some medicine. Now that is partially all right, but she has come up with a lipoma inside the stomach. So I thought, where is she? Whether she is becoming normal or she is going back to abnormalcy. I couldn't decide. I was referring to theory of separation and I was discussing with other doctors also. But I was even guilty, like whether I'm doing some good to the patient or not. This is what going in my mind. So I couldn't decide, but I took the symptoms. I got meserium and sepia. So she being very indifferent and the symptoms were very often and other things. I wanted to repeat sepia. So I gave sepia 30 and I asked them to repeat. But now she still started throwing up vomiting. This has become very abnormal. And so I sent them to some of the surgeons and they told like this is a rare condition and it is just a lipoma. Nothing to worry. And since it is inside the intestines, it has some pressure symptoms. That is why she is vomiting. This is what they have given a picture. And they told, if you are doing better, you just continue with homeopathy. To my surprise, this is also again a surprise by an allopathic physician who is going to say, okay, you go ahead with homeopathy. And she came back to me and she was just presenting with the same wave-like motion in the abdomen and projectile vomiting. I repeated only sepia and I sent her. But these symptoms are not subsiding. But she, this disease prognosis was getting worse rapidly. And suddenly she ended up with vomiting severely and they admitted in the hospital and they got to know it is a cancer. It's a cancer. It's a very rare type of cancer and the lipoma which was diagnosed started spreading to the other parts and she is very badly responding to any kind of treatment. So they couldn't even finalize the protocol to treat her. By the time they discussed and arrived at a protocol, she's so is one case which I lost in spite of I treating her for 1 year where she recovered better and for 1.5 years she was all right and she throwed up with mild symptoms of psoriasis but ended up with cancer. So the disease prognosis was worse. The moment I sent her to the allopathic physician, they had given some injections also. It has suppressed this disease and no more sepia or Caliars was working and the potency selected was also maybe a mistake. So I admit this, but I learned a lesson. So when the patient is not following up for a year or so, it is your duty to call them and find out if they are interested, to find out and assess the case, how they are doing. And in the recovery period or when the disease is not in that acute stage, it is our duty to treat with the anti-miasmatic or any prescription or any individualistic miasmatic prescription so that she could not have ended in this pathetic condition. In spite of she being directed to homeopathy, I couldn't help her. I feel sad about that, but that gave me some amount of experience. So I learned a lot from this one case. So, so I would like to conclude here with these many cases. Hope I have shown some insights on the follow-up and retrospective analysis. How important is a retrospective analysis to understand what we are doing to the patient. So the takeaway message I give here is through success, we learn and earn experience, earn familiarity, earn more patience, earn money. But from failures only we learn and we earn the best experiences. So though I was guilty, but I learned a lesson to follow up the patient to how much ever extent possible from my. Thank you. Thank you so much for IFPH for giving this wonderful opportunity to present some of the cases. So if anybody has some questions, we can take.
Thank you, Dr. Veena, for such a wonderful session from you, because you just talking about the follow-up and retrospective analysis. Of course, this is a very good thing that everyone has to follow, because a follow-up is something great. Everybody, whenever a patient come and to say that, doctor, I'm having this much of problem, but I am having a relief. But today I have this problem. Suddenly, we may tempted to give some medicine. That is what happens. But we wait and see whether it is a normal symptom of the disease or something, some other reason behind the symptom. Sometimes, if we wait, we can see that the symptom itself may vanish without any medicine. But at times, we need to change the medicine, or sometimes we need to give some acute medicine at that time. And that's what we will have to look into. And as you rightly pointed out, that in Kerala we have this cerebral amoebiasis or meningitis. This is what happens nowadays, and a lot of news is going about this particular disease. This is a hype that being created by the media to usually people may fall in such line that, oh, I am having this symptom, so I may be suffering. I am also having this disease, so I may be get into death like that. So this kind of phobias are not good. But I still remember a case of a chicken pox while treating. What I found it was that the person while treating, the patient was not responding, not even calling. But that means that the patient is better. Actually, he was better for some days, some 3 to 4 days. And thereafter, one day, one fine morning, his wife called me. He was a person of having about some 40 years. And so she called me and told me, the doctor, my husband is not doing well, and he's looking at the window, at the top of the roof without changing his eyes. So I felt that there is some trouble with his head. So that is something, some trouble is happening in his brain. So I rushed to his home, and what I found that this is exactly what the condition of the patient. He was having staring look, and he's looking at the roof of the roof of the room. And when we look into, when I asked what happened and when it happened, she told me that last night, this patient is having so much of pain in his leg, and he is not able to walk. So from the very talk itself, I understood that there is some problem with his brain is going in this. So that means the disease condition is getting worse by means. But then I have to wait for some times, and then I told him that don't worry, to the family, that we can manage the situation. I just call the lab persons to come over there and to check the blood and everything. And all those things were very high at that time. That was creatine level is getting high. His ERP was very high. ESR is more than 100. And then what I just do was that anyway, I have the confidence in our system. And so I just took the case, and opium, one arm was given. And thereafter, I went by the evening, and also I asked them to call me regularly, every 3 hourly like that. They called me and informed that, doctor, he's doing this and that. And by evening, when I found that the patient is started moving slowly, his eyes, I started moving. And on the very next day morning, the next morning, when I reached there, I found that he's a little bit fine. I took all the photos and video was there. I have presented this case in our in some of my presentation in the earlier editions of our webinars. and within 2 to 3 days, he become normal in that way. Anyway, what happened was that, as you say, that the sorry condition went into syphilitic stage, as you rightly point out. But in those conditions, the confidence in the, frankly speaking, you may be frightened whether to move forward, or you just allow the patient to go to the hospital. If I say I might have sent him to the hospital, he may be in IC and the condition may be little more worse than what happened. So if we have the tools to cure the patient, that's what I have to say. Just like in your case also, you told about the case. Frankly, this is what follow-up is all about. Follow-up, one need to assess the case, and one need to understand what is there in the case and how to go into the depth of the case and what will be the prognosis of the case, whether it will go to bad or. But the thing is that you need to observe each and every time to find whether the patient will be getting back to normal or not. But we have enough tools with us, but utilizing that, using that tools in the right time will definitely help the patient. So this is what the follow-up is very important, I must say. So choosing such a wonderful subject in this evening is really a very appreciable thing, and we congratulate you for bringing up such a session in this forum. And some of even what will happen in acute disease, how can one manage in chronic disease, and all those things were discussed briefly, and very nice presentation. And it is the time for discussion. And those who want to participate in discussion can join the session. Of course, Dr. Manoj is here. Doctor can add something more on that, because he's a person who is having very depth of knowledge in organ and philosophy. So I invite Dr. Manoj to.
Thank you, Dr. Ganesh. Before that, Dr. Jayalalitha raised her hand and she's waiting.
Yes.
Dr. Jayalalitha.
Yes, Dr. Veena, it is an excellent session. Thank you. And first, I first hear that the capsicum is best for vitamin D deficiency. Thank you for sharing your knowledge. And the next case, you told that lipoma case, a lady with lipoma case, you give her Calisulf, isn't? And which potency was that? Dr. Veena?
It was Cali hours and I gave 30 potency with
Cali hours.
Very less
Okay.
repetition.
At the correct time, you investigation done there and referred this case to allopathic physician, and he support with homeopathy. It was excellent. Thank you, Veena. Please come again to the same platform with the next excellent sessions also. Thank you, dear.
Thank you.
Okay.
Thank you, Doctor.
Yes. There is no doubt about the potentials of these young talented physicians. That's the most, we are very fortunate to have such fellows in our platform. As you mentioned, the role of miasm is most important. The metastasis of disease that nobody can predict. The last case you mentioned was the lipoma, it was turned into a malignancy. So very difficult. At the same time, only I think with our philosophy, we can at least predict. As Dunham says about the nature and conditions of a natural science should capable of provision. Then another one should capable of infinite progress. So provision for provision. Yes, that's most important thing. Because we can, just the Abrotanam case or Calmia case, a lot of ways medicines are there. The metastasis is there. Moreover, the transition from the least vital part to the most vital part is also there we can expect. So that's the importance. Whenever the patient is selected a medicine, you should suspect. But when you select a remedy, definitely you can expect. So there is a gap. There's a big gap between these two. But unfortunately, we are not at all bothered about that. We want to arrive a conclusion. Yes, this is the medicine. We got the medicine. So that's why Kent advises, when you are in doubt, don't. But how much it is possible? we don't have such a mental state. We have to develop our mental capacity still more. And what is more important is the reading. The philosophical reading is very much important. Then again, the repetition, potency, all these things, diet and regimen, all these things are very important. Nice presentation. You have mentioned the Kylie Adam, then the capsicum. Then an interesting reference by Dr. Ken. Yes, it is a devilishness. The capsicum patient is a devil. That is the word used by Kent. So again, you please come again. You regularly attend our programs, just like Dr. Tanesh. He is doing all sorts of hard work. After his practice, rushing to the platform and conducting all these things. Really, we must appreciate Dr. Tanesh and must give some sort of kudos to him because the tremendous work. Thank you, Dr. Veena, for coming and presentation. Thank you.
Thank you,
Thank
Dr. Manoj. Yes, Dr. Veena, you get very good appreciation from one of the philosophical doctorate holder, I must say, because he, even though doctor has not get this PhD, but he deserved it. But such a he's having such a depth of knowledge in our philosophy, organon and philosophy. Dr. Manoj, why can't you try for that? Even at this age, people are doing that.
Yes. After my retirement, I hope so. Otherwise, very difficult. Because in the philosophy, a lot of ideas there, but to capitalize on that, we need hard work. Because Hahnemann in philosophy is beyond our all expectations and our thoughts. It is totally based upon the what we call the minuteness, the infiniteness. It's not at all easy. When he described about the cause of disease, you can refer in the first aphorism of first edition, aphorism 17 footnote. A wonderful exposition is there, but he has that aphorism was changed because he came to understand that it is not at all possible for a common man to understand all these things. Dr. Veena, you can refer that. First edition of Organon, aphorism 17 footnote. That much depth is a philosophical depth. So without, as rightly said by Kent, those who don't have a philosophical bent of mind can't understand homeopathy. Even at last, Kent said, what homeopathy God only knows. That much depth is, that much extent. Again, we can't imagine how the potentization brings the power of medicine. How it becomes possible to use all these potent medicines into safe medicines. The cyanide, the inert silicea, the hepar cell, the Kali cell, all these chemicals, poisons, all these were converted into safe medicine, proved medicine. Remedy you can use as remedies. That's the talent of Hahnemann. So only by adopting the Indian philosophy properly, going through that in depth, we cannot understand homeopathy. Okay.
Yes, Dr. Veena, you can add something more on that.
Actually, speaking a very well said narration, Dr. Sir, because when we are speaking about Dr. Hahnemann, he has given the chronic diseases, he has given the organon, he has given the metromedica. Three important things of homeopathy. So how did he arrive at? He had done a tremendous job, tireless job on this to give to this world about all these things. Now today we are speaking about nano technology, quantum physics. No one can imagine a person who has given insights about or the basics about all these things 200 years before. It's very highly surprising what kind of intuition or what kind of divine power he had to discover all these things which is hidden and given in whatever science available at that day to make the people understand. You go by the symptoms, you understand, analyze, give medicines and follow up like this, give medicines. This is Herring's law of cure. He has thought about embryology, which was at the nascent stage at his period. Now we think when we study about embryology today, we can understand how we have to approach cure. With Herring's law of cure, just relating to it to the present science, which is very scientifically given, narrated, but at that time the science was not in this stage, in this advanced stage in his time. Still, he was able to give insights about you follow this and give medicines like this so that you will end up in cure. How many cases he would have retrospectively studied day and night to give this one, what to say, gem to make us all successful homeopaths. I'm not saying just a homeopath, successful homeopaths. They're treating in and around cases acute, chronic, and we are ending up cures only because we are this time science is standing after so many years without any single flaw. People may comment good, bad, right, left about homeopathy, but it is a science. If people have the knowledge, they will appreciate the depth of this science. If people have half-cooked knowledge, they will not believe, they will question everything. But as and when the science keeps growing, it will keep explaining how this science has emerged. And one fine day, they will grab this science and they will say it is theirs. That day will also come.
Yes, the foundation of homeopathy, I think the Indian philosophy says Karya Karana Abheda Siddhantam. There is no difference between the cause and effect. These effects are only the manifestation of the cause. That is why we are totally depend on the individual symptoms. The individual symptoms are nothing but the reflection of the cause. Now, recently, they are saying about this, the genetic medicine, the genome theory, the manifestation of the character of gene, but the phenotype is still out of the syllabus.
They
Still.
say precision medicine to hit
Yes.
the right organ or right place. So that is not in like it is not treated in masses. Should be treated in individualization. So all his theories are getting accepted slowly, but they don't want to give the appreciation to homeopathy or Dr. Hahnemann because of the half-baked knowledge which is currently available. When things
Yes.
are proven, it will get set.
Yes, definitely one day will come and where Dr. Hahnemann will get the Nobel Prize, because people will realize that what was homeopathy philosophy and whether it was working and how it works now, and what was the relevance of homeopathy in those days and the present day. And nothing has changed, but the homeopathy is still there in the same way, but it is improving. That it is flourishing like anything. That's why we reached the second largest system in the world, and homeopathy will grow because of persons like you are still there, and you people are carrying out such a wonderful method, because you are just, and you, I know that Dr. Veena is enjoying every bit of your practice, and that's what the physician who enjoy the beauty of this system definitely will be the most successful physician. That's what, according to our Dr. Kent in his philosophy. So this is what every physician need to be, and must be, and should be, and shall be. And the person always started loving our session, and once you go in that way, definitely you will be the winner here. And this is what I would like to say about your session. You really deserve kudos from all the people here and those who watch us in the coming edition of our time. And tomorrow we will have a session from Dr. Ankita Kushwala. She is from Bihar and presenting anger migrate in homeopathy. Another philosophical subject is coming on tomorrow also. So with that we'll have to wind up the session. I invite Dr. Manoj to say a vote of thanks to the session also.
Thank you, Dr. Veena, for your wonderful presentation and all those participated, and Dr. Ganesh for coordinating all these things. Thank you once again.
Thank you, Dr. Manoj, and those who attended the session once again. And tomorrow we will see the same, we will meet at the same time. Good night. And so over to Dr. Manoj to moderate the Malayalam session now.